Welcome back. If you're joining me for the first time, my name is Dr. Ivy Branin. I'm a New York-based naturopathic doctor focusing on women's health and hormones. And if you like this video, don't forget to like it. And of course, if you don't want to miss any of the great content, don't forget to subscribe to my YouTube channel. So, as we all know, we've been, in this pandemic for the past, I guess it's been now 2 years. And so many of us are now using more and more practitioners virtually, whether it's your therapist, your psychiatrist, maybe even your endocrinologist. A lot more doctors are doing more virtual appointments. We also call virtual appointments telehealth or telemedicine. And so I want to talk a little bit about what happens in a virtual appointment, and is there actually anything different between virtual versus an in-person appointment. So even before the pandemic, I always had some of my patients that were using virtual sessions. So when we talk about virtual sessions, what we're talking about is instead of having a traditional appointment that would be in an office, we're talking about having an appointment at the convenience and comfort from the patient's either home or office using a video conferencing service or platform, something like Zoom or Skype. Some patients with iPhones could also use something like FaceTime, or for patients without computers, and I actually still have some patients that don't necessarily have computers or internet service, using the phone. So basically, instead of coming into an office, using a different type of platform so that you can have your appointment at the convenience of your own home or office. So what are some of the benefits of having a virtual session, or what are some of the benefits of telemedicine? Well, the first thing definitely is no longer having to travel. So meaning, instead of having to get into your car, take the subway, take the train, and then finding parking, paying for the Uber, you actually get to do it from the convenience of your own home or office. The other thing is when we think about ease of scheduling. So rather than having, because again, if we think about the time it takes to travel, so it's not just about the actual 1 hour appointment, but you're tacking on another 30 minutes to an hour. So it actually allows more patients to schedule appointments throughout their day, and not taking so much time away from work or other commitments. The other big thing, and this was actually even before, again, the pandemic, is a lot of my patients wanted virtual appointments because of childcare. Having coming to the office was just not worth the time, the money for childcare, and so that they're able to actually have the appointment at home while they're also tending maybe their 1-year-old, their 2-year-old. This also was helpful with some of my patients that are children. So some of my pediatric patients, their parents actually found that it was better for them to have a virtual appointment rather than having to take the child or infant to my office. The other again, similar category is I had some patients, again, before the pandemic, who had various mobility challenges, and for them to get into a car or even taking a car service was much too difficult. In fact, actually one of my patients, interestingly, had a condition that if the temperature outside changed dramatically due to a prior head injury, it became extremely painful. And so she found that it was so much relief that she was able to still have an appointment even if there was adverse weather changes, and she could do that from the comfort of her own home. The biggest thing I really find of what is the benefit of telemedicine is we're now able to give access to patients that might be in areas, specifically when we think about naturopathic medicine is not that common. There's not that many of us. So some patients live in an area where there is no naturopath. And so I've been able to see patients not just in the US, so not just in other states, but I actually now have a lot of international patients. In fact, I have 2 patients from United Arab Emirates, Kuwait, South Africa, South Korea, and then a couple of my patients have now gotten jobs overseas. So I do have a patient, for example, in Dublin and another patient in Paris. So if it wasn't for telemedicine, telehealth, these patients wouldn't have access to naturopathic services. So what are some of the main difference between in-person and virtual, and what are some of the considerations when making the decision to book a virtual appointment? So really, at least I find in my practice, really the only difference between in-person and virtual is literally the physical part. One you're doing from home via, again, either Zoom, Skype, or your phone, or traveling and going into an office, maybe sitting in the waiting room. Who doesn't sit in the waiting room? So basically just streamlining and having, so with the virtual appointment, we actually end up doing all the same things. So in my practice, I use electronic charting. So I'm typing during the patient's visit, and everything that the patient is saying is recorded, meaning registered, and then the patient at the end of the appointment will receive their treatment plan via the electronic charting. And because I've never really liked killing trees, even before the pandemic and even with my in-person patients, I always sent their treatment plans electronically to cut down on paper. Also, I find that my patients wouldn't lose it if I sent it electronically versus, obviously we can lose paper. The other thing is that I always get questions about is labs and diagnostics. So again, I've never done any of those things in-house. It was always something either I would refer out or depending on, again, what state my patient is in. So really there's no issues at all at getting any of that laboratory work done, nor getting the results to me. Specifically, most of my patients, when they get the results in, they upload that into my patient portal. The other question I sometimes get was like, well, if you prescribe something, how will I get it? Well, again, back to the age of the internet. So my practice uses an online dispensary. Specifically, I use Full Script. There's also another one that a lot of my other colleagues use called Wellevate, and it's quite simple. At the end of the appointment, I enter in my herbs, the nutrient recommendations into Full Script, and my patients receive their prescription, typically usually the same day or within the hour of that appointment. All they do is they go onto Full Script, they fill the prescription, and typically in 2 to 3 business days, my patient is ready to start taking the supplements that I recommend. And also just the way that I practice, because this is also something I always get asked, is, well, what about physical exams? Well, even before the pandemic, that was never really part of my practice. And also, even though I work a lot with dermatological conditions, specifically acne, I have found that through Zoom, I can make an accurate determination of what's going on with the skin, as well as having patients send me before and after photos. This has been really helpful in me developing a treatment plan that's appropriate for my patient. So now I know there's a lot of information about how virtual appointments work and what is the difference between virtual appointments versus a classic in-person appointment. You might be wondering, okay, so how do I get started? I'm sold. I'm ready to book that virtual appointment. So the easiest way is that you can click on a link in the description of this video, which can take you to my online scheduler. And of course, you can always also go to my website, simplicityhealthassociates.com, and you can also access the online scheduler there as well. Well, hopefully this was very informative, and now that you understand more about how telemedicine works, And if you like this video, don't forget to like it and also subscribe to my YouTube channel. We're always coming up with really exciting content, and you can go through some of my history on fibroids. I have a lot of videos on menopause, painful periods, and also how to deal with yeast infections naturally. So hopefully I'll see you next time. Everyone, have a great day. My name is Dr. Ivy Branin. I'm a naturopathic doctor, and I'll see you next time.